All right. Good morning, everybody. This is Ray Walker with the Medicare Assistance Program. We're really glad you could join us again today for our second webinar in this year's series, Map to Open Enrollment. Thank you for joining us for these webinars as we're getting ready for open enrollment, which starts in 4 days. October 15th is the starting date. So we're coming up on it very, very quickly. Wanted to make a point. I was talking yesterday to one of the people that we help every year, and we're scheduling an appointment for her to come in for us to do her review of her prescription so that we could identify the best drug plan for the coming year. And she made a really good point. She didn't want to schedule her appointment too early in the open enrollment season because she wanted a chance for her and her husband to speak to their doctors to find out if there were any changes that the doctor wanted to make related to their prescriptions, if they wanted to increase a med or decrease it or change them, maybe take them off of some of their medications. So I thought that was a really good idea. So I thought, hey, I'll just pass it on here at the beginning of our webinar. If you've got any providers that you think might be looking at making some changes to your prescriptions, wouldn't be a bad idea to get in touch with them now and maybe make an appointment and see if maybe there isn't something that is going to change for the coming year so that we can make sure that any med changes are included in any of the comparisons that we do. So I just wanted to throw that out there. Wanted to welcome all the beneficiaries that are joining us on today's call. We're really glad that you could come and join us and that you're taking the opportunity to get better equipped for open enrollment. Also wanted to say good morning to all of our certified counselors out there, the folks that are working in the area agencies on aging, community action agencies, private nonprofits, and within the tribes to provide the counseling for our seniors across the state. Also, we have a number of insurance agents and brokers who are joining us. We're really glad that you could be here to learn more about what's coming up for the coming year. I did want to point out, though, that this webinar is not for CE credits. It's for information only. So if you'd like to learn more about what's available for CEUs, you can go to the OID website and look under licensing and education. For anyone who missed our webinar from last week on Medicare Advantage plans, wanted to remind you that you can actually go to the Oklahoma Insurance Department website at oid.ok.gov, and you go right back to the area where you registered for these webinars, and the recording for last week is available there. So if you did miss it, or you know someone who missed it that might benefit from that, you can point them there and they can see that webinar at their convenience. Also wanted to remind you that we've got 2 more webinars after this one. Next week, we're going to be talking about Medicare Part D and the prescription drug plans. And then the following week, Gay Humphreys and her team are going to be talking about Medicare current topics as well as coordination of benefits. So would really be a good idea for folks to attend that one as well. So if you've not registered for those, again, you can go to oid.ok.gov and you can register for these events at that website. All right, so now we're going to go ahead and get started with today's webinar, and we're going to be talking about marketing guidelines. This is a big topic. All of us are seeing the commercials and hearing about all the different reasons why these plans that are available are the plan we should be enrolled in. So we're very fortunate to have an expert here with us that can share with us some very important information. Carmen Irwin. Carmen has worked for Medicare for the past 25 years. She started her career working in the anti-fraud department as one of the Medicare contractors, and that's where I first met Carmen. After a few years, Carmen moved on to beneficiary outreach and education. In the fall of 2002, Carmen accepted a position with CMS in the Dallas Regional Office. Carmen has worked with several Medicare contractors for both program integrity and Medicare policy. In 2016, Carmen became the Rural Health Coordinator for the Dallas Regional Office. Carmen's primary role is the Provider Education Lead for the Division of Local Engagement and Administration in the CMS Dallas Regional Office. So Carmen, thank you so much for joining us, and I leave it with you. Go for it.
All right. Thank you very much, Ray. Good morning to everyone. And I would just like to say that we're very excited to be here. And we're excited about open enrollment starting October 15th through December 7th. And we're going to just go over some of the marketing guidelines with regards to our Medicare Advantage and our Part D plans. You've heard from my counterpart last week, Gay Humphrey and Angela Kane. And we'll continue providing you information as we go into this open enrollment. So we thank you for attending. Thank you to Ray and his staff for allowing us to come to you and provide you this information. So with that, we'll get started. And I just wanted to go over some of this information with regards to the marketing guidelines. Now, for those of you that want to get a little bit more in depth, these are going to be highlights and kind of a top level. There is, of course, in CMS website, there's the entire document that encompasses the marketing guidelines for our providers. So if you are curious to go out there and look at that, it is available on the CMS website. So without further ado, we'll get started. Excuse me, let me get this working here. All right, so we're going to talk about three different topics within this presentation. We're going to talk a little bit about the background information with regards to marketing. We're going to talk about acceptable marketing practices, and we'll have a little interactive, which is, can they do that? So next, let's talk about the background information. So we know that marketing and communication kind of go hand in hand, but for CMS's perspective, there is a definition or defined the information with regards to both marketing and communication. As you can see here, communications are those materials and activities that provide information to current and prospective enrollees. So of course, October 15th through December 7th, you're going to see that type of communication with regards to open enrollment. Here is an example. A flyer reads, XYZ Health is now offering Medicare Advantage coverage in Nowhere County. Call us at 1-800 and the number for more information. Very acceptable. That is the type of communication that is provided because, of course, you as beneficiaries and caregivers and individuals that are seeking more information about these Medicare Advantage plans, this is the type of communication you would see. Now, one of the components or a subset of that communication is going to be those marketing advertisements, so to speak. So a subset of the communication is, of course, the marketing. And what is it there for? To influence or to provide further information to the beneficiary or the consumer with regards to healthcare coverage. And that includes the marketing content. So of course, here's another example. A billboard that reads, XYZ Health offers 0 premium plans in Nowhere County. Both of these are acceptable, and both of these are just examples of the types of communication and marketing that may be out there during this open enrollment. Now, when we talk about open enrollment, we know that there's always, of course, this push to provide educational events. However, there are guidelines that go hand in hand with these educational events. So before, must be explicitly advertised as educational. So if you're seeing something from a plan and it talks about education, it has to be advertised as such. Now, during this educational event, the plan may set up a marketing appointment. So you've come to provide or to get education from the plan with regards to Medicare Advantage. At that point, they could set up later an appointment and distribute business cards or contact information, all very above board and legal. However, the event must not include marketing or sales activities or the distribution of those marketing materials or enrollment forms, because this is been advertised as an educational event. Now, after the event, the plan can conduct marketing and sales events, an event with marketing and sales in that same general location, but there has to be definitive separation. This was an educational event from 8 to noon. Here's the facility or here's the place in that same area. They could then say, if you want more with regards to our marketing and our sales, here's a separate event. It can't be conjoined. It has to be defined. And then, of course, the beneficiary makes the decision on whether or not they want to go and seek that marketing or sales information with regards to the plan. Now, of course, there's more information. It's designed to steer potential enrollees. What are we doing? We're trying to provide that choice to our Medicare beneficiaries. Do I want to know more about XYZ plan and what they're providing? The health plan and drug plans must submit those talking points and presentations to CMS prior to using them. So, of course, they've sent this to CMS before this contract period for the enrollment for 2023. And these items that can be used by their agents and brokers, but it must be cleared by CMS. Now, in addition to marketing and sales events, those plans cannot require those individuals who choose to attend to provide their contact information as a prerequisite for attending the event. Therefore, if somebody wants to come and hear the information, they do not have to provide their contact information. However, while there, if they choose to do so, yes, please, I would like further information. At that point, they could provide that information. Sign-in sheets must be clearly labeled as optional. They cannot be required. And then health screenings or other activities that may be perceived as or used for cherry picking are not permitted. We don't want individuals or plans saying, if you are not COPD or have these types of ailments, sign here. Because again, it's supposed to be across the board. You or that individual, Medicare beneficiary, you're looking to see if this is something that I want to enroll in, if this is a plan. And therefore, the plans or those companies cannot limit or make a decision based on how that beneficiary qualifies. So that information cannot be used. In addition, the contact information provided for such things as raffles or drawings may only be used for that purpose. It cannot be aggregated or collected for further contact. If you're providing, or if you go to an event and they say, here's a beautiful basket that you can win, and you fill out that information for that basket, it is solely to be used for winning that basket. It cannot be used for handing off to say, we'll return or get in contact with you. So there are defined criteria and regulations that limit how these plans and these sales events go. So as we get into the sales and marketing, we also want to get into acceptable marketing practices. All this to make sure that we have checks and balances in place to protect Medicare beneficiaries and to ensure that these plans are doing what they are supposed to with regards to Medicare regulation. So here are some of the general requirements. Plans must make it clear when an encounter with the beneficiary is moving from just communication activity to a marketing activity. And when a beneficiary is being transferred to a sales or enrollment representative. And before the beneficiary, before transferring, the beneficiary must clearly consent to being transferred. At the end of the day, it is based on the fact of, does the beneficiary know what's next? I have a phone call. This phone call now has become a marketing event or marketing situation where I've inquired more about that plan or what they're offering. And now that individual that I'm speaking to says, Mrs. Smith, if you feel comfortable at this time, I'm going to transfer you over to someone that can help you make those choices or enroll you into our plan. They have to be clear. The beneficiary has to understand, and making sure that that communication is done so that the beneficiary later says, I have no idea, that I don't know what happened. The next thing I knew, I was talking to someone else. So there has to be clear, defined transferring of the beneficiary when those types of engagements are done. In addition, the plan type must be included with the plan name when it's first mentioned, or in a way that prominently conveys the type of plan to the actual recipient or beneficiary, and must not be misleading. In addition, these are just checks and balances when we come to beneficiaries making that decision or enrolling in that plan. Very, basic. You and I are sitting here scratching our head goes, well, this is how it should be. Absolutely. But from Medicare's perspective, these general requirements have been put into place so that we won't get into a situation where beneficiaries don't understand, we're not told, or similarly, at the end of the day, are now saying, I want out of this plan because I was misled into it. So, of course, plans have to make sure that they are going or abiding by these general requirements. Now, marketing during open enrollment period. Ladies and gentlemen, we're almost there. We're in 4 days. It will be Medicare open enrollment for calendar year 2023. So what do the plans have to do, and what type of marketing is known or as being acceptable? So knowingly targeted is prohibited by Medicare. So marketing messages aimed at generating interest or leads during OEP are generally prohibited unless it is noted below. So the requirement does not restrict a plan from the following. If you're providing educational/marketing materials upon request by the beneficiary, that's fine. Marketing for 5-star plans, totally within the limits of Medicare. Marketing to dual eligible or LIS beneficiaries, also fine. And then using mailers aimed at individuals aging into Medicare. This is all allowed for the plan. However, it does not restrict the plan from doing this. It's just knowing what guidelines. And the plans have been provided this. Again, I'm going to mention again that there's a marketing guideline. There are all these regulations out there on the CMS website. So it's not a secret. It's accessible to anybody, and they can follow and make sure that those guidelines are being held or being conducted appropriately by the plan. So we're going to do a little bit of a learning check, and hopefully you guys have got the juices flowing this morning. So if you would like to, you can answer in the chat. So we're just going to have a few examples. So in this line, is this line acceptable for marketing products during an open enrollment period? If you're not happy with your plan, change now. Yes or no? I'll give you guys a few minutes. No, this is considered unacceptable marketing. So do realize that there are just certain things. At the end of the day, you are just saying, Medicare, you have an open enrollment. You as the beneficiary make the decision. You do your due diligence, make sure that you want to be in the plan for the next year, but that marketing or that line cannot be used. Here's another example. I'm sorry, sorry. So let's talk about a little bit about the scope of an appointment, the SOA. And this is when, of course, a person, an individual, maybe an insurance broker or someone's coming out to do something with the beneficiary. What is the scope of that appointment? And the scope appointment documentation is required for all marketing appointments. So this is a requirement set up by CMS. So that scope of the appointment must include the following. What are the product types to be discussed with that beneficiary or that consumer? What is the date of the appointment? And then the beneficiary and agent contact information. A statement stating no obligation to enroll, current or future Medicare enrollment status will not be impacted, and automatic enrollment will not occur. Now, a new state of appointment is required if the beneficiary request information regarding a different plan type than previously agreed upon. Again, checks and balances to ensure that beneficiaries, when they're setting these appointments up or working with a plan or an insurance salesman or representative, that it's very clear what is going to take place within that appointment. Now, here are some of the reminders for the scope of appointment. The former recorded call must specify the product type to be discussed. What exactly is the appointment set up for? Are you going to discuss a Medicare Advantage plan with, Part D and other items associated with it? It's required for all one-on-one appointments, regardless of the venue, whether it be in a home, whether you're doing an appointment in a common area senior center, and only market health-related products. So if those appointments are set up, that is for marketing of the health-related product. That is the scope of the appointment for the individuals that are setting up these appointments with Medicare beneficiaries. Now let's talk a little bit about rewards and incentives. So Medicare Advantage plans marketing of rewards and incentives must include the following. not be used in exchange for enrollment, and be provided to all potential enrollees without discrimination. So this is across the board. If a Medicare Advantage plan is going to provide a reward or incentive, it cannot be used to entice to enroll and be provided to anyone that's inquiring. So again, no discrimination there. Medicare drug plans may not develop, use, or market rewards or incentive programs. So specific to Medicare Advantage plans. And then nominal gifts are different from rewards and incentives. And we'll talk a little further about nominal gifts and with regards to the differences. So our nominal gift reminders, plans can offer a nominal gift to potential enrollees for marketing purposes. And this again is in the marketing guidelines. Per individual item or service, it has to be $15 or less. The maximum aggregate of all the gifts per person per year is $75. Now, given regardless of enrollment and without discrimination. So if a plan is going to provide a nominal gift, it's to anyone that's there. It's not based on whether or not they enroll in the plan or do not enroll in the plan. And it may not be in the form of cash or any type of monetary rebate. And again, this is listed within the Medicare guidelines for marketing. Now, marketing promotional activities, they must be offered to all, regardless of enrollment. Again, no discrimination. If you're going to provide it, it's to everyone. Not be items considered a health benefit. So it can't be a health benefit if you're doing promotional activities. And may not provide or subsidize meals, but may provide refreshments and light snacks. So items given cannot be reasonably considered an entire meal or multiple items bundled as a meal. It can be light refreshments and snacks. And this again, geared toward promotions and activities that will be taking place, of course, during open enrollment by these plans. So we're going to do another little knowledge check. This one's quite interesting. I have to be honest, it caught me off guard. So which of these two items is a nominal gift? Is a $15 Starbucks gift card a nominal gift? Or is a $15 Amazon gift card a nominal gift? I'll give you just a minute to think about that. The answer, the $15 Starbucks gift card. The Amazon gift card is not, because the Amazon gift card is considered cash equivalent because it's to a retailer that sells a wide variety of consumer products. Because the Starbucks card is specific to Starbucks only, it is not considered a cash equivalent. So just an example that was put out there to make sure that we understand and the plans understand what can be provided. All right. So this is where it's going to get a little interactive, and I hope that you all are ready to get involved with me. So can they do that? Let's check it out. So unsolicited enrollee contact. So what's allowed for unsolicited marketing activities, or what can it include? So it can include conventional mail or other print media. So of course, during this time period, you'll get a lot of stuff in the mailbox, or you'll see all these advertisements. And then the email can be sent, but it must have an opt-out function. So if an individual receives that email, there has to be something in that email that says, I want to opt out of this advertisement or this solicitation. Now, what's prohibited unsolicited marketing activities? Of course, door-to-door solicitation, not. Approach in common areas, or telephonic solicitation. It is not allowed. And as you can see, the big red X. So misleading statements. So what can happen? And may a beneficiary who has been given advance permission, due to a business card, must use the CMS approved third-party marketing organization disclaimer language in the first minute of the call. And all calls have to be recorded and stored. And we know that this is new for contract year 2023, but they can call a beneficiary who has said, yes, I would like for plan XYZ to contact me. But they also must use, they being the plan, must use the CMS approved third-party marketing organization disclaimer language in the first minute of the call. And again, all calls must be recorded and stored. What can't happen is that the provider, or I'm sorry, the plan cannot state that they are from Medicare or use words or symbols, including Medicare, which is in a misleading manner for the beneficiary. They cannot state that they are approved or endorsed or authorized by Medicare or calling on behalf of Medicare, or that Medicare asked them to call or see the beneficiary. These are very specific when we talk about types of advertisement solicitation to the Medicare beneficiary. Again, and I hate to harp on it, but all this information is available in that marketing guideline that's posted on the CMS website. Some marketing in a healthcare setting. We know in the past we've heard a lot about marketing and where it could actually be conducted. So marketing you can, or the plan can, conduct marketing and sales activities in common areas of healthcare settings. Maybe a conference room, a cafeteria, maybe there's a health fair in one of the recreational rooms, assisted living centers, or other congregate housing, excuse me. What cannot take place is that marketing cannot take place in restricted areas, such as a hospital room, in a dialysis center, pharmacy counter areas, exam rooms. That cannot take place. Again, very defined in which this marketing can take place. And if it does happen, we would really urge either the beneficiary or the individual, maybe a caregiver. If something does occur of that nature, please contact Medicare either through 1-800-Medicare, or you can contact 1-800, the OIG, the Office of the Inspector General's toll-free line. Either way, you want to make sure that people are doing as they're told. We want to ensure checks and balances when it comes to our beneficiaries, and ensure that the plans are doing their due diligence to enroll or provide information to beneficiaries appropriately. Now, cross-selling prohibition also exists. So plans are prohibited during any Medicare Advantage plan or Medicare drug coverage sales activity or presentation on cross-selling other items. They cannot market non-health related products such as annuities, life insurance, or other products. If that plan is providing information with regards to healthcare, that's exactly what that marketing appointment interaction has to be. Now, that being said, they can do or have the opportunity, if the beneficiary is calling inbound and request information from a person with Medicare with regards to other items that they're selling, that's fine, but it has to be initiated on that inbound call. So the beneficiary calling or seeking that information, but the cross-selling cannot happen when the plan is making some type of interaction due to selling a healthcare product. So again, just clarification of cross-selling. Now we're going to get into the fun part. Can they do that? We've talked a little bit about the background of plans and marketing, contact, communication. We talked about setting up the appointment, what can be done, what is allowed, what do plans have to do to ensure that they're abiding by Medicare's guidelines. So we're going to get into a little bit of interaction here. Can they do that? So here's the first one. The beneficiary says, I received a mailer for XYZ plan PPO, which is a 5-star plan. Can they do that? Yes or no? I'll give you guys a couple seconds. Yes, they can do that. Again, we talked about that communication. And as long as they're just providing information with regards to whether it be a mailer, it's not targeted, and they just providing information, content that's specific to that plan, it's fine. All right. Number 2, I'm getting calls and text from a plan without my permission, and I'm not a member. Can they do that? Yes or no? Everybody's getting involved here. I love it. All right. No. They cannot do that. Again, you can't send information, the calls and the text. Now, we did talk about email. As long as the email was sent with an opt out, that's fine. But text and calls cannot be done. Those, the beneficiary would have to actually do the inbound for anyone to provide information, especially if they're currently not a member of the plan. All right. A plan's offering cash if I join. Guys, this should be the nerve right here. You see this vein right here would start popping if this actually happened. But I'm just saying, no, there's no monetary enticement, inducement for any type of enrollment activity when it comes to Medicare or a Medicare beneficiary on any avenue, on any platform. No monetary inducement. That would be automatic. Someone calling the Office of the Inspector General for further review or investigation of fraud. All right. I got an unwanted email, but it included an opt-out function. Can they do that? I gave this one away, I think. Yes. Again, a plan can send information via email to individuals as long as there is the opt-out function. That has to be within the email to qualify or to meet the standards or regulations set up by Medicare. All right. Can they do that? Number 5, a representative tried to talk to me about their plan in a hospital patient room. Can they do that? All right. No. Now, we did discuss this when we talked about where they can hold any type of information or reach out or provide information to Medicare beneficiaries. Common areas, whether it be a conference room or maybe they have a area that's set up for, health fairs, things of that nature. Not when it's a hospital room or somewhere closed in or where the beneficiary doesn't have the opportunity. It's something more open. And those maybe a resource center, things of that nature, but not specific to a hospital room, a doctor's office, things of that nature. That is not, cannot be done. All right. Can we do that? Number 6, Plan XYZ PPO is ranked highest in customer service in Nowhere County in 2022, according to a national poll cited here. So if you saw this and this type of advertisement, is it doable? Yes. Again, not specific, not stating that it is Medicare approved or Medicare sent them, but it is based on a national poll, and they're just providing information that they are highest ranked in customer service. We do know that there's the STAR program with regards to Medicare, and that 5-star program is required or is set up to identify just that. Do we have plans that are rated by consumers and providers alike, that they meet that type of classification? And stating that information, whether it be from a poll or some type of information, is fine, because it goes back to who they are, a 5-star plan. So that is not prohibited with regards to advertisement or marketing of the Medicare Advantage plans. All right. So that is all I have for you today. However, before I leave, I do want to just reiterate 3 things. And I think Ray started off talking about them. First of all, due diligence on the part of our Medicare beneficiaries, whether it be them as individuals or caregivers. There's several avenues to look at with regards to getting your Medicare coverage for 2023, whether it be original Medicare or a Medicare Advantage plan. The point here is that there is a standard way to do that with regards to making sure or ensuring that our Medicare beneficiaries are protected. Doing their due diligence, providing education and outreach from the plans, that's fine. It's when things are not black and white or not made clear that we have beneficiaries making choices not based on education or information given up front. So we want to ensure that. Number 2, as a Medicare beneficiary, like Ray was saying, you have that time, October 15th through December 7th, do some savvy shopping, ask those questions, ask for information. You know, that is your right. This is your health care. So you want to ask for the information, you want to ask for clarifications, you want to ask for items in black and white. And you have that right to do so. And talk to your providers and those clinicians and facilities that you use on an ongoing basis so that you can make an educated decision with regards to what you want to do or what avenue you would like to go and proceed into 2023 getting your health care. So again, here at CMS, we're more than happy to provide you the information available. Do realize that all these resources are available to you out on the website, cms.gov, and we can provide more links. The most important, of course, is to the Medicare marketing guidelines. Those are updated. They're out there for anyone to look at. And if you have a question or something is not clear, please reach out to either Medicare, 1-800-MEDICARE, through your SHIP and AAA, and they can get you either access to those resources or the answer to your question. So with that, I do want to we do appreciate your participation and feedback. I know we're working with the Oklahoma SHIP here, but if you'll just let us know if this type of information does a good job for you. It's voluntary if you want to use the QR code or use our link here, so that we do a better job providing information and outreach to both you and our partners in the field. So with that, I am gonna open it up for questions, Ray.
I love a QR code with a little T-Rex in the middle. That's pretty fun.
It's pretty good.
Okay, great information. So don't forget, guys, if you've got questions that you want to ask, please chat them in the chat box in the lower right corner. I do have some that I want to ask. Pardon me. So when we talk about the materials and the do's and don'ts, and this is the difference between communication and marketing and stuff, there's such a fine line. The layperson, there's really no way for them to differentiate between the two. So really, the onus is on the plans to be policing themselves and stuff. And really the way we would find out about it is if somebody came to a counselor or to someone from CMS and said, is this cool? And it would go from there. And so we do have ways that we can report those things and get those looked at and stuff. But as you said, and I wanted to stress this, before anything goes out from United, from Humana, from any of those carriers, that has to be approved by CMS. Now, that doesn't mean that maybe an independent agent hasn't created something of their own that might cross a line. Do those fall under those same guidelines?
And Gay, correct me if I'm wrong. If an independent agent is promoting or soliciting for that plan, the plan is responsible for whatever item that agent is. So plans have an onus on their own to really make sure that these agents are doing their due diligence and doing it correctly, because the plan has the final responsibility under Medicare's eyes. Yeah.
And plans are being much more diligent this year. That's part of the responsibility that they have, because the plans contract with sales folks and marketers and all that. So the plans are as responsible for this marketing misrepresentation as the marketer is, because they are in effect working for that plan. So
Okay.
can I just share one thing that we didn't
Please.
clarify too much in the PowerPoint, but right at the beginning, one of the things said that one of the slides had the statement that there's a marketing disclaimer that has to be a part of the scope of appointment in talking to a person. That disclaimer is for them to say, and they don't have to use my words, but to convey to the person that not every plan that that plan may sell across the country is offered in this area. So, if Joe Namath has got something fancy that sounds really good to them and they'd like to have that, and that's all they're interested in signing up for. Well, they need to understand that not all those plans will be offered, and we will tell you which ones are. So I think that's, that's a pretty important, because none of the marketing that I've seen has said, well, see if it's available in your area, that kind of stuff. So,
Yeah, and we ran into that same situation early on. I think it's been fixed, but where the commercials were actually promoting assistance programs that were actually government programs. They weren't necessarily a program offered by that plan, and that I think again has been addressed. Annette is asking, so any telephonic solicitation is prohibited?
Right, unless the beneficiary has sought inbound, you cannot solicit a Medicare beneficiary through a Medicare Advantage plan directly to that beneficiary. And if it occurs, that is the type of information that needs to be reported, because again, the plan is the one that is ultimately responsible. And so that information has to be relayed back. Now, if the beneficiary has filled out maybe an email or sent in a request for further contact and provided their number, then that is an inbound, considered inbound, not direct solicitation.
Okay, great. On the gifts, the nominal gifts and the limitations and stuff, the $15 per item, easy to understand. $75 aggregate, trying to track that, I'm thinking probably really impossible.
well, I've laughed about that one too, because it's the same thing. Who's tracking that?
Yeah.
And all of you have been at events or whatever where it doesn't matter if it's a pencil or a ballpoint pen, somebody is going to scoop up a big old hand of whatever it is. And we have frequent flyers who go from one event to another event to another event, just getting all those koozies or whatever people are giving away, and so I'm not sure how they actually police that, but the intent is that everybody gets one, and we aren't going to discriminate. But I'm sorry, ma'am, you are up to $82, and we can't let you have any more.
No more pet.
Yeah, exactly. It's not like there's a tax credit or something.
Right, right.
Annette had a add-on to her question as far as what details do we need to report or help our beneficiaries to report. I'm assuming this is on if they're getting those unsolicited phone calls, and I can tell you they can give us the phone number that the company, any information, any details they can provide to us is going to be helpful. It's going to be very challenging because unfortunately they can spoof these phone numbers. We have no way of knowing for sure who we're getting back to, but the more details that they can provide, the better. And then feel free to forward those to us. And we can put those through. We have a second grant called the S&P grant that we're always looking for ways of identifying people that aren't playing by the rules. So, and Carmen, who used to do this fraud stuff all the time, go for it.
No, I just want to point out, and it's going to be hard. I've been doing this for years, but the main thing I tell all the beneficiaries and caregivers that I speak to is, and it's going to be hard because my grandmother did it too, and my mom. If you don't know the number, let them leave a message. You don't have to answer the phone. And that's the hardest thing to get across to our minds, because we're so programmed to answer the phone right then and there. And what we need to do is just, if someone leaves a message, then you have the proof. And I always say, if you don't know that number, and that is not a number that if they want to get in touch with you, they're going to leave a message. So don't break your leg trying to get to the phone, or, stop cooking or turn off your favorite show. If it's not a number, do not let them leave you a message. It's not worth it.
Absolutely. And also the other thing, Annette, is one of the things that Carmen pointed out, if they talk about they're from Medicare or they're representing Medicare or endorsed, that's information that we need as well. As Carmen pointed out, they are required to record all these calls starting this year. And it would be something that we could report, and they could go back and listen to the call to find out if there was a violation. So
absolutely.
Someone asked, is there a list of the plans offered in our area? And it depends on what your area is. The Medicare and You handbooks that came out this year, and if you didn't get one, we've got a supply of them that we can send you one if you need it. In the back of the book are all the carriers that are offering plans in Oklahoma. As far as your specific geographic area, Plan Finder, you go in, you put in your zip code, and it'll tell you what plans would actually be available in your geographic area if you wanted to, whittle that down a little bit. So use that. Another question that was related to, what can they do and all that stuff. And we get this one all the time. The snack versus the meal. So is that like a grilled cheese, no chips? Where do we draw the line on, and do they have to like bring like a sample, like in a baggie, for us to weigh? I mean, is that again, just one of those things that it's a guideline. It's not a rule that somebody's going to get sent to the chair for, right?
Right, exactly. And I think that, in my previous life in the fraud and abuse, we're talking the difference than somebody saying, please come to the local steakhouse for a free meal to hear me present about all these wonderful insurances I provide you, versus going to a senior health event or something and they have maybe cupcakes, chips, candy, and you just swing by and pick it up, or maybe refreshments, sweet tea, unsweet tea, coffee, juice. That's what we're kind of looking at. It's not these boxed lunches or dinner, or you come in and you can have the all you can eat Chinese buffet. I mean, the reality is the enticement or inducement to pull in a beneficiary or someone of that nature. So
Okay. All right. Donna also asked, where can I get a Medicare and You handbook? As I said, we order extras. They go to every household where there's a Medicare beneficiary, but we know a lot of our counselors don't get them and stuff. We have lots. So you can email me, you can call 1-800-Medicare and get one there. You can go online and you can Google Medicare and You handbook. Now, the ones that if you look at the one that's available online, it does not have the plan information in the back for your state. So if you want one with the state specific information, get one from us. So
I do want to
yes,
add there
Carmen.
too. I want to add, Ray, too. If you need specific, Medicare does provide Braille, large print, even audio. You have to go to the Medicare website to order those, but they are free. In addition, and not to discount the SHIP and the AAA, several libraries we know in certain areas, it was predominantly rural areas, also request and have accessibility to Medicare and You handbooks, because it is a resource or a reference.
That's wonderful. Now, I should have mentioned this. We do have the Medicare and You handbooks. We also get the ones that are in Spanish.
Yes.
So we've got some in Spanish if somebody needs one of those there as well. Next question. The no cash issue. They can't give people money. But we've got a lot of Medicare Advantage plans that one of the new, and we use the term supplemental, which creates a lot of friction, but one of the new benefits that they can offer are these cards that they can use to buy groceries and gas. And so it's like, okay, so it's not cash, but it's groceries and gasoline, which cost cash, so it seems a little wishy-washy, you know what I mean? And I know that's not something that you guys can necessarily answer, but it just, what's the
Well, it's
concept
that
there?
$15 limit for one thing, and if it, like, let's look at the Starbucks example for a minute.
Mhm.
Starbucks was considered to be okay for the Starbucks gift card because all you can get from that is something at Starbucks. But Amazon cards or a Visa gift card or something like that would not be acceptable because you can use that anywhere. And so I think that's the main thing to look at. So not be good for some investigation about
Yeah.
I think also you have to remember that when you talk about the added flexibilities and waivers that are provided by a Medicare Advantage plan, that is for an individual that's enrolled and meets that criteria. So it's after the fact. That it's not, I mean, it should not be used as a selling point because again, the beneficiary would have to enroll in the plan and qualify for that benefit. So it would be after the fact in which they would receive these additional services. So it's not so much as it should not be used as an enticement or an inducement, but rather if the beneficiary already enrolls in that plan and they meet the criteria set up by the plan to receive those benefits, then it's an after the fact.
Okay, so is it typically limited to like the D-SNPs, like the ones that are for duals, rather than the general population? They're pretty new to us here in Oklahoma. We've not had a lot of this. This year, we've suddenly got more of these supplemental benefits, and I know they've been available in other states for quite some time now. So
It's up to the
we're kind of
They're
feeling
not
around.
necessarily D-SNPs though.
Okay,
Yeah, I think they're, they're kind of across the board. They can offer those.
okay.
So,
Yeah, we're learning, as you know, when you get on Plan Finder, it tells you they've got additional benefits, but
Sure.
the parameters are missing in action. So we are trying to get information from the plans themselves about some of this and trying to identify other resources that are available to our counselors where they can get that information so that we can tell people. Wanted to go ahead.
No, I was just going to say, and let me use an example. There are some plans that provide transportation benefit. Within, if the beneficiary gets enrolled due to rural and access of, provider network and things of that nature, but it's limited. And some of them are limited to only 40 miles. So again, it's not, I would not see it as an inducement to get someone in the plan, but rather, is it a benefit once I'm in the plan as to what that plan provides for me? So there's going to be different accessibilities provided by whatever that plan or that private insurer is willing to provide to those beneficiaries that are already enrolled in their plan.
Yeah, we've definitely seen a huge increase in the number of dual SNPs that are going to be available this year in Oklahoma. And so it's definitely going to be important for all of us, whether you're someone that's eligible for a dual SNP or a counselor that's helping those people, we need to become aware of what the basic benefits are for someone who's on Medicare and Medicaid to find out, to really evaluate what is this going to add value for them to get on one of these D-SNPs that gives them some additional dental coverage, vision coverage, transportation, gym membership, things like that, to make it of use to those people. And of course, always we tell them, make sure that your providers are on those plans. So, all right. Does anybody else have any questions before we get going? Guys, I really appreciate it. This has been a really good webinar again. I think we've had some really good discussion. Wanted to thank everybody for attending and remind you that
thank you.
next week's topic is going to be the Part D. Are you guys going to join us for that one?
Yeah.
That would be great if you can. I mean, I know I'm the one talking, so please don't heckle. You're going to heckle anyway. I know you will. But anyway, if you could join us, that would be great because I do think it adds a lot to the discussion. If you would like to hear the recording of today's webinar, probably will be available around 3 o'clock this afternoon. Go back to the oid.ok.gov website, and it will be available later this afternoon. Also, don't forget, open enrollment starts Saturday. No, we're not open on Saturday, but Monday morning, you can call 1-800-763-2828. We would be happy to help you to review your coverage, whether that's your Part D plan, your Medicare Advantage plan, whatever that might be. We want you guys to give us a call. Also, want you to make sure that you're giving us a call if you suspect any kind of fraud. As Carmen was talking about, there's lots of stuff going on out there. Number one, if you don't recognize the phone number, don't answer the phone. It's important to leave a message. But if something does happen and you think somebody's taking some action with your information, give us a call. Or if you feel like someone's pressuring you to make a decision that you didn't want to make and that you already made and that you want to go back and reevaluate it, let us know about that as well. So unless you guys have anything else you want to add, I appreciate y'all's time and look forward to hearing from you next week. Have a good day.
Okay, bye, everybody. Thank you.